Pain medicine, an important tool for patients of illness and surgery, dominates the American drug industry. Because of this, the large corporations that manufacture these drugs own a monopoly built off of corrupt policies. These pain-relieving drugs are created to get patients addicted to increase profit off of the already expensive medicine. Most American doctors are trusted by their patients, especially with prescription drugs. Unfortunately, 20% to 30% of these patients abuse their prescriptions and become addicted. This is not their fault. Examples of these drugs are codeine, morphine, oxycodone, and hydrocodone. Around 8 to 12% develop an opioid use disorder. The Midwestern region saw opioid overdoses increased 70% from July 2016 through September 2017. Opioid overdoses in large cities increased by 54% in 16 states.
Despite this, doctors continue to prescribe them. Because of the outrageous price and lack of availability, many addicted victims turn to heroin and other cheaper and dangerous alternatives. About 80% of heroin users stem from the use of opioids. This trend is more common in lower income areas who can't afford the prescription drug. 63% of drug overdose deaths directly involve opioids.
Although America suffers this epidemic of addiction, there is hope. If the general public is made aware of the crisis, many addictions or deaths may be prevented. Doctors will continue to prescribe these opioids without fear of the consequences. There are alternatives and less dangerous methods to relieve pain that have less addictive effects. If the educated public is aware of the harmful effects of these opioid drugs, they can turn to these alternatives.
When people realize the effects of drugs, they have to face another burden, which is paying for drug rehabilitation. Drug rehab is a major financial burden for families. It can cost $2,000 to $25,000 for those who don't have insurance. The rates could be astronomically higher. For example, according to 2016 report by the U.S. Department of Defense, rehab for opioid addiction costs about $6,552 per year for methadone-assisted treatment, $5,980 per year for buprenorphine-assisted treatment, and $14,112 per year for naltrexone-assisted treatment.
What we can do is improve access to treatment and recovery services, promote the use of overdose reversing drugs, strengthen our understanding of the epidemic through better public health surveillance, provide support for cutting-edge research on pain and addiction, and advance better practices for pain management. Drug addiction therapy should be required upon arrest instead of prison time. This government interference will push people to not see their addiction as a crime, but as a mental illness instead. This will most likely improve the opioid crisis in America.